Hey everyone, it's Zach Greenwade here at Performance Sport and Spine, and today we're going to talk about how to assess your hip flexor and whether they're tight or not, or whether there's something else going on and exercises or strengthening that area is a more effective way of managing it. So commonly with certain movements, when you stretch your hip, you'll feel tightness in this anterior groin thing, and intuitively our first thing is to stretch it. But what we can do is this simple test that I'm going to show you on how to assess whether your hip flexor is tight in terms of a range of motion or flexibility thing, or whether there's tonus issue that needs exercising. So the first thing you do is you lay on your back, bring your knees towards your chest, hold one leg in, not all the way down, make sure to keep your back flat. And you want to see if you can bring your leg all the way down so your femur, your thigh bone is parallel to the ground. If you can, and it still feels tight, it's more about tonus than tightness, and stretching is not the answer. You also want to make sure that you can do it with a straight knee. If your leg starts to laterally deviate, it's probably because you have a tight TFL that we can address in a different video. So if you're feeling tightness at end range, then we need to strengthen that muscle, not stretch it, which we'll go over next. So now that we've assessed that it's more of a tonus thing than tightness thing, we're going to work on some initial exercises to strengthen your hip flexor. The first one is just a seated psoas march. So you're going to sit with about knee width height, and you're just going to lift your leg up and down, keeping the knee bent at 90. Try to make sure that it's your hip doing the motion and your lumbar spine, your low back, is staying out of it. So this is the first one. And then the second one, you just need a band. You can get these on Amazon. They're very common, a PT band. You're going to place it around your legs, walk out a little bit, support with your arms, and just bring one leg up and pause, down, and one leg up and pause and down. Try to keep your knee straight and drive your other knee towards your chest, slow and controlled. If these are too easy, we'll progress to the intermediate stage next. Okay, now we're going to progress to the next phase of exercises that are a little more challenging. You can start there if you want, or you can do the first ones and then progress depending on your current fitness level and injury status. So this one is just the standing psoas march. Sometimes I like people to start with a dowel as support. You don't need it. But if you find yourself really shifting your weight really far to compensate, it's probably better to use a dowel a little bit. But just again, like the seated one, bring one leg up, pause, try to shift your weight as little to the stance leg as possible. The next one is again that psoas march, but now you're going to make it a little more challenging by laying on your back and just press one leg, fully extend, come back, and then press the other leg out. Try to make sure that your foot gets all the way down to your hip level rather than keeping it up here. You want to make sure you get that full range of motion of that hip joint and strengthen it through all of that. Right now we're going to do the seated straight leg march, and you're just going to get here, keep your knees straight, and lift one leg up at a time. Sometimes it can kind of be a little stiff on your back, so if you need to put your hands behind you, that's fine, but basically just lift your leg up, keeping your knees straight and down, alternating. All right, and now we're going to progress to the last tier of exercises. These will be the most challenging. Again, you can start here if you feel like you're up to it, or work up to these through the other ones that we talked about already. So this first one is the standing banded psoas march. So you're going to try to keep your weight on the stance leg, bring the other leg up, nice, slow, and controlled. Sometimes it can be effective to come all the way up and hold an isometric in this top position. Sometimes people feel the most tight in this top hip flexion position, and this can help build tolerance to that. Again, depends on the person and the context. The next one is just going to be a lunge with a posterior pelvic tilt. What I mean by that is think of your pelvis as a bowl. You're either going to pour the water out the back, or you can think about bringing your navel to your chin. So once you're in this position, you're going to lunge down, straight up, lunge down, straight up. If it's not challenging enough, you can add some external load, dumbbells, barbell. Again, find that tilt, come down, come up. The last one we're going to do is just an active straight leg raise. So you're going to straighten your leg, keeping the other leg bent, back flat. Use that hip flexor to bring it up all the time. You might feel a pinch in here, that's okay. Down. Again, slow up, slow down.